Go.
Hi. Now specifically I want to share with you the effects of Alzheimer's disease on the body. At first you may think that because Alzheimer's affects primarily the brain, it's not a bodily problem, but it is. It becomes more of an issue with the body as the disease progresses. However, it's very important for you to understand the manifestations of Alzheimer's in the early stages. First of all, Alzheimer's disease is a global loss of neurons, which are the wires that connect your brain and allow your brain to communicate. The wires are not connected like in a circuit when you think of electricity, but connected by a chemical called neurotransmitters. All people who have Alzheimer's disease have loss in their neurotransmitters. We're not sure why. We don't understand if the loss of the neurotransmitters is the cause of the disease or a result of the disease. But it's important you understand that all the drugs based on trying to help the person with the disease are trying to replace the neurotransmitters that appear to be deficient. These drugs are temporary measures and have a lot of side effects, but may be useful and important in your family. Go to your physician. The thing I want to explain to you is a little bit about the brain. The cerebral cortex is the big, large portion of the brain that separates us from animals. It's the portion of the brain that allows us to appreciate music, art, language, to appreciate each other, to have a personality, to love, and to share. This is a six-layer area on the surface of the cerebral cortex and is the primary area that Alzheimer's disease affects. Because it is involved in every adult and childhood way of communicating, appreciation of all the things I've mentioned in the past, you can see how as this portion of the brain begins to fail, the patient begins to lose their own identity. The most important thing you can do in trying to deal with someone who has the disease, or if you are someone who has the disease, is keep your mind active and support those relationships that are good and close, warm and loving. Do things for yourself that make you happy and bring you joy. Learn, read, and allow yourself permission to not be able to do things too. Do not criticize or put yourself down. Your brain is slowly but surely dying. Small neurons are dying. That's the truth of Alzheimer's disease. So be forgiving, patient, loving, and tolerant as those nerves leave you.